Taoiseach, I have raised on a number of occasions now, since late 2017, the disgraceful treatment meted out to the hospices, the disability organisations and mental health services by the government on a consistent basis, particularly in relation to the government's failure to restore their pay, the pay of their employees, in line with other health service employees. And from the outset, the government, and indeed the Minister for Health, has been dishonest on this issue. The hospices and the disability organisations are being treated as second class, and their employees as second class citizens. They implemented FEMPI in 2010 and 2013 and were excluded deliberately by the government from the pay restoration public service agreements of the last 2 years. The government has stalled and stalled on this issue. And we all know that these organisations depend significantly on voluntary donations and fundraising out there in the community. They receive an average of about 75% of their total annual revenue operating costs from government. The rest they have to fund themselves, and in particular almost have to raise all their own capital. They've had no increase in funding in recent years to meet increments and non-pay inflation. And since the early 2000s, the demand on their services has almost doubled. Now, in the context of our health services, hospices in particular are efficient, effective, have huge impact, have won the trust of the public, and yet they're being treated in a very cynical, dishonest and shabby manner by government. Why they were ever left out of the pay restoration estimates and allocation is difficult to comprehend. But somewhere a cynical decision was taken to brazen this out. The goalposts keep changing, the story keeps changing. But essentially these organisations have been hung out to dry. Now, Taoiseach, I raised it with you in October of 2017, November 2017, January of this year. You keep shifting the goalposts. This fundamentally is not an industrial relations issue. It is a funding issue. It is one of basic fairness. The hospices, the disability organisations have been shortchanged. They will simply have to cut services, Taoiseach, and they've warned us about this, if the pay restoration does not happen in line with other health service employees. So, Taoiseach, I want to ask you, they're in a funding crisis right now. Can you confirm that funding has been allocated in the estimates for 2019 to facilitate pay restoration for the employees of hospices and the disability organisations and those covered by Section 39? And when is the government going to do the right thing in terms of treating the employees of these organisations in a fair and in a just manner?
Taoiseach.
Thanks very much, Deputy, and welcome back. First of all, I hope you had a nice summer. I want to, of course, start by joining with you in acknowledging the really valuable and really important work that is done in Section 39 organisations, whether it's hospices around the country, like my own St Francis Hospice very nearby to where I live, whether it's disability organisations around the country, whether it's people involved in social care. I think everyone in this House will understand and respect the important work that is carried out by these organisations and their staff. As has been explained in the past, Section 39 organisations are not part of the public sector, and the staff in them are not public servants. As you pointed out, on average, these organisations get 75% of their funding from the state. But as we all know, on average doesn't mean in all cases. So in some cases the funding from the government may be as little as 10 or 11,000 euros. In some cases almost all their funding may come from the public purse, and it's different in different circumstances. In almost all cases, these organisations have had budget increases in recent years. There hasn't been a budget freeze for Section 39s in recent years. In fact, the money paid to Section 39s taken in aggregate, on average, as you may use the term, has increased in the last couple of years, every year in the last couple of years. Analysis has been done by the Department of Public Expenditure, which is not yet complete, and what that does show that the situation is very different across these different bodies. In some cases, they have paid the increases, they have paid the pay restoration. In some hospices they have, for example. In others they have not. In some places they are entirely compliant with public sector pay policy, mirror almost exactly public sector pay policy and pay rates. In others they do not. They use that flexibility in some cases to pay more or pay less as they deem appropriate for their activities in their area. And we do know from the analysis so far that some can afford to pay and some cannot. So the fact that there is such a difference across all of these different bodies means that it is a complicated problem to solve, but it is something we want to solve. It's now a matter that's being considered by the Workplace Relations Commission. Minister McGrath has met with SIPTU, one of the main unions involved, very recently. Minister Donohue's met with the head of ICTU to discuss this, and we do want to resolve it. We want to include in the estimates for 2019 some monies to resolve the situation, but it does require coming to an agreement, and we haven't yet come to an agreement on how that can be done.
Your answer really reeks of dishonesty. And let's cut the verbiage, the waffle and all the talk and the average and all the rest of it. I met the 5 hospices yesterday. Bottom line is you haven't given them the money to restore pay. You haven't. The reason there was strike notice this week was because one hospice didn't pay. There's been no retrospection, there's been no pay. The Minister for Disability should be up in arms about this in terms of disability arguments. St. Joseph's and Charleville, I've met them. They're in debt, in a crisis. So let's cut all the nonsense, the waffle, because when the cuts happened, the HSE went down to each of these organisations, to the CEOs and said, cut. If you don't, we'll cut your money. They're the only people in the health service that were excluded deliberately, cynically, from the pay restoration agreement. There's no rationale for it, Taoiseach. Now, we've got all of this. I got a similar reply to you. You mentioned St. Francis in every reply. I get fine. But the reality is you said the same thing over 12 months ago. You've been seeking information for about 15 months.
Thank you, Deputy.
The people love the hospices of this country, Taoiseach. They will do anything for them. Now, it's about time government did more than just sip a cup of coffee with them and a cup of tea and actually give what they're entitled to. The same as the nurses and all the other health alliance professionals working in other organisations in their health service. You know and I know they shouldn't even be Section 39 organisations. They should be fully integrated with our health service. And we should take lessons from them because they're the most trusted and well received, the most popular services in our health service across the country.
Thank you, Deputy Taoiseach.
Deputy, what you may call waffle and nonsense, other people would call facts. And the fact is they are Section 39 organisations. They're Section 39 organisations in the Health Act, an act that you brought into this House. They are not publicly owned bodies. These are private organisations that receive grant funding from the government to provide a particular public service. That is the way it works. So these bodies receive.
Can the Taoiseach be allowed to respond without interruption?
And Labour Court determinations apply to the employer. And in this case, the state is not the employer. And the way these organisations work is they receive grant aid. They receive a grant from the government. They also have their own income streams. And they have a decision to make as to how they spend the money that they're given. As I've said, some organisations have given their staff pay restoration. Some have not. Some can afford to. Some cannot. Some receive almost all their funding from the state, some do not. So this is not a straightforward situation, but it is one we want to resolve. We do want to include in the estimates for 2019 some funding to provide for pay restoration for staff in these organisations. But we cannot yet calculate that figure until we get to the bottom of what it is for a start. We need all the data from these organisations to get that, and then we need to have an agreement with the unions to achieve it.